So again, pretty complex issue, and that's why I wanted to present that. Pretty complex case, multiple injuries going on. What I found was expedited return to sport pretty significantly. I will tell you, there are several different things that I do with all of my athletes that I think are absolutely imperative when you're doing BFR. Number one is thinking outside the box. Number two is keeping within standards of practice when using BFR. Number three is making sure that you're pushing hydration. Hydration, I will talk about this in a moment, is very critical. Number four is pushing nutrition. We want to maximize the results, and knowing how the BFR works from a biochemistry standpoint in order to optimize that effect, I believe that nutrition is a critical part of that. So with all of my athletes, I always talk about hydration. I always talk about nutrition. And I'll share with you why I do that from the biochemistry standpoint. So in this example, I'm putting the cuff up on my arm, and what I do is I tighten up the cuff. Knowing that veins do not have muscle and arteries do, what happens is as you tighten up the cuff, you collapse the vein and the artery is still allowing blood into the muscle. So now you're performing a very low load, typically 30 to 40% of 1 rep max for resistance. I'm doing my exercise, and as I'm doing my exercise, blood is flowing into the muscle. As that blood flows into the muscle, there's a point at which the muscle can no longer take any more blood. Because blood is not leaving the muscle because you collapse the vein, the muscle will begin to fill with blood to a point where it can no longer take on any more volume. Once that volume, once it reaches that volume capacity, what ends up happening is you're still exercising, is you start to deplete that blood of oxygen because there's no new blood coming in. There's only that oxygenated blood that's in there. And as you continue with your exercise, what's happening is you're pulling that oxygen off that blood. Well, eventually you exceed the oxygen capability of that blood. No longer is there oxygen that is available. So as you've depleted the oxygen from the blood, you're still doing this light resistance exercise. You're still performing the exercise. What ends up happening is that the muscle then starts to become fatigued. It is that point at which the muscle starts to become fatigued that you start increasing motor unit recruitment. Now, this is a key concept with blood flow restriction training because it is this motor unit recruitment that you get that typically you do not get unless you are doing 80 to 85% of 1 rep max. So the beauty of BFR is that you can get that increase in motor unit recruitment at very low loads. That means there's less stress to the joint. That means there's less stress to the surgical tissue, etc. And at the same time, you increase that motor unit recruitment.